Sometimes we struggle to understand how to maintain our health, right? The digestive system is a complex but vital part of our body. Did you know that you can understand the messages your body is sending by simply looking at the state of your stool? Healthy stool is a mirror of our overall health, and elements like color, shape, and frequency provide important clues about the condition of our digestive system. So, how can we assess our stool health? What should we know about constipation, diarrhea, inflammation, and more? Make sure to watch the video until the end to not miss any of this information. In this video, we will thoroughly examine what healthy stool looks like and the signs of gut health. We will also discuss what changes in stool mean and how to cope with these situations. Before we start the video, don't forget to subscribe to our channel and like the video. If you're ready, let's begin. Healthy stool. Healthy stool is one of the most important indicators of our digestive health. So, what does healthy stool look like? The color and shape of stool provide us with significant clues about the overall condition of our digestive system. Healthy stool typically has a brown color. This color comes from the bile pigments present in the stool. The shape of the stool is also quite important. It should ideally be smooth and sausage-like. Stool frequency is another critical factor. Having a bowel movement at least 3 times a week is considered normal. If your frequency falls below this range, you should consider that there may be an issue with your digestive system. Additionally, the transit time of stool is an important point to note. Stool should pass through our body within 24 to 72 hours. If your stool is hard or difficult to pass, this could also be a warning sign. Healthy stool acts like a map showing how our body functions. Now that we know about healthy stools, let's take a look at what our stools indicate and under what conditions. Constipation. Constipation is a common issue that affects the quality of life for many people. Having fewer than 3 bowel movements a week is defined as constipation, which often indicates that the digestive system is not active enough. Additionally, if stool passage is difficult, or if the stool is hard, it is also considered constipation. The Bristol stool chart allows you to assess the consistency of stool. This chart provides information about the consistency and shape of the stool, helping you understand the degree of constipation. If your stool falls under Bristol types 1 or 2, it may indicate constipation. One of the main causes of constipation is a lack of fiber. Fiber is essential for the proper functioning of the digestive system. Inadequate fiber intake can lead to hardening of the stool and make it more difficult to pass. Additionally, not drinking enough fluids can also increase the risk of constipation. Therefore, it's important to include fiber-rich foods in your daily diet. Increasing physical activity can also help promote bowel movements, thereby reducing the issue of constipation. Inflammation. Inflammation may be a sign of digestive system issues. Soft and irregular stool can indicate an inflammatory condition. If you notice a significant change in your stool, it could suggest that something is wrong in your body. Inflammation can often be a precursor to more serious problems, such as irritable bowel syndrome or bowel inflammation. It is important to have regular health checkups to avoid encountering such issues. Inflammatory bowel diseases include conditions like Crohn's disease or ulcerative colitis. These diseases lead to inflammation in the intestines, affecting the frequency, consistency, and color of stool. If you are consistently experiencing soft, irregular stool, it is advisable to consult a doctor. Additionally, consuming anti-inflammatory foods such as turmeric, ginger, and omega-3 fatty acids can be beneficial in reducing inflammation. Gastrointestinal bleeding. Gastrointestinal bleeding can be a serious concern when you see black or bloody stool. Black stool usually indicates that the bleeding originates from the upper digestive tract. This condition may be indicative of issues like peptic ulcers, gastritis, or variceal bleeding. It's also essential to pay attention to other symptoms. For example, if you experience abdominal pain, fatigue, or weight loss, you should seek immediate medical attention. Additionally, seeing bright red blood in the stool can also be a sign of an underlying health issue. This often indicates bleeding in the lower digestive tract, and can be associated with conditions like hemorrhoids, anal fissures, or colon cancer. If you experience such symptoms, you should seek medical help without delay. Diarrhea. Diarrhea is a condition that many people encounter and is typically characterized by watery and irregular stool. The causes of diarrhea are quite diverse. Stress, dietary changes, infections, or allergies are among the most common causes. It is essential to compensate for fluid loss during diarrhea, as dehydration can lead to serious health issues. Symptoms of diarrhea include abdominal cramps, fatigue, and increased frequency of bowel movements. The treatment for diarrhea depends on the cause. If infections are involved, appropriate antibiotic or antiviral treatment may be necessary. Additionally, consuming probiotics can be beneficial in balancing gut flora. Fermented foods like yogurt support gut health and can speed up the recovery process. Liver or gallbladder issues. The color of your stool can provide clues about liver or gallbladder issues. Pale or gray stool can indicate a lack of bile. Such a change may suggest that the digestive system is not functioning properly and that component deficiencies are occurring. Liver diseases can lead to serious health issues, such as hepatitis or cirrhosis. Liver health significantly impacts your overall health. A healthy liver plays a critical role in detoxifying the body and digestion. Therefore, supporting your liver with a healthy diet is important. Consuming plenty of vegetables, fruits, and adequate fluids is crucial for maintaining liver health. Green stool. Green stool is often the result of excessive consumption of green vegetables. However, it can also indicate that bowel movements are occurring too quickly. If your stool is consistently green, it may be a sign that there is an issue with your digestive system. Additionally, some food colorings or supplements can also affect stool color. Green stool can sometimes occur due to iron supplements or the consumption of certain foods. However, if your green stool persists and is accompanied by other symptoms, you should take this condition seriously and take necessary precautions. Hemorrhoids. Seeing bright red blood in your stool may indicate hemorrhoids. Hemorrhoids often cause discomfort and pain during bowel movements. The main causes of hemorrhoids include a lack of fiber, excessive straining, and a sedentary lifestyle. Consuming fiber-rich foods, drinking adequate fluids, and exercising regularly are ways to prevent hemorrhoids. Fat malabsorption issues. Lastly, yellow and greasy stool may indicate fat malabsorption issues. Malabsorption means that the intestines are not able to absorb nutrients properly. This condition can lead to various health problems. Yellow and greasy stool is often associated with pancreatic problems or intestinal infections. Symptoms of malabsorption include bloating, diarrhea, and abdominal pain. We have reached the end of our video. If you've watched this far, it means you enjoyed our content. So, don't forget to subscribe to the channel and give this video a like. Follow us for more content, and see you in the next video. Have a great day.